Finding the right support for a teenager's anxiety can be a very difficult process. What if one potential tool wasn't a typical anti-anxiety medication at all? This is Lamotrigine, and it's used when anxiety is tied to emotional instability. It's considered for anxiety that shows up as irritability, overwhelm, and sudden mood swings. We will break down how Lamotrigine works, who it's for, the safety protocols, and its place in a teen's treatment plan. First, the facts. Lamotrigine is not FDA approved specifically for anxiety. Its usage for this is off-label, a common medical practice. Because of this, it is not a go-to, first-choice medication for generalized anxiety. Guidelines don't recommend it as a starting point. Instead, it's often used as an augmentation strategy, added when first-line treatments like SSRIs are not providing enough relief. So if it's off-label and not a first choice, what makes it a considered option? The answer is found in the brain's chemistry. Our brains have a neurotransmitter called glutamate. It works like the main on switch or the gas pedal in a car. Lamotrigine's primary job is to gently turn down the volume on glutamate release. It doesn't slam the brakes. It just eases pressure. By regulating this excitatory system, it stabilizes the foundation, preventing the extreme highs and lows that can worsen anxiety. This mechanism explains why it's not for every type of anxiety. So, what specific symptoms might indicate it's a potential fit? It's considered for teens whose anxiety is not just quiet worry. Think sudden irritability and feeling easily overwhelmed. How does this work in a real case? One case study showed its usage for a teen with PTSD and chronic stress. By regulating the glutamate cortisol circuit, it reduced self-injury behavior. A key point, in that case and in general practice, medication is not the only solution. It works alongside therapy, like CBT. Now that we have seen the potential benefits, we must discuss the risks. This is non-negotiable information for any parent or patient. The most significant risk is a rare but serious skin reaction called Stevens-Johnson syndrome. While very uncommon, it is a medical emergency. To minimize this risk, doctors use slow titration. This means starting with a very low dose and increasing it gradually over many weeks. Because of this slow start, Lamotrigine is not a quick fix. It can take 1 to 2 months after reaching a stable dose to notice benefits. Just as starting is slow, stopping must also be gradual. Abruptly discontinuing can cause withdrawal or a return of mood instability. With these serious considerations, why is it still a valuable tool? The answer comes when we compare it to other options. Unlike benzodiazepines used for acute anxiety, Lamotrigine is not habit-forming, making it a much safer option for long-term management. Recall how it gently regulates glutamate instead of causing widespread sedation? This often results in fewer cognitive and sedative side effects. Additionally, it's considered weight neutral. For teens, avoiding medication-induced weight gain is a significant benefit for treatment adherence. So, you get a tool that targets the instability behind anxiety, uses a precise brain mechanism, and offers a better side effect profile. This creates a clear picture of the candidate, a teen with anxiety mixed with mood swings who hasn't responded to first-line treatments. Let's bring it all together. Lamotrigine is a nuanced, off-label option for adolescent anxiety. It doesn't treat anxiety directly, but by stabilizing mood and regulating the brain's excitatory system, it can reduce anxiety from that instability. The decision to use it requires a deep, collaborative conversation with a qualified psychiatrist. A slow titration process is absolutely necessary. Medication is never the whole answer. It is a tool to create stability so other strategies, like therapy, can be more effective. If this profile sounds familiar, the goal is not to request a drug, but to have a more informed discussion with a doctor. For the right patient, this carefully considered approach can be a turning point, representing a move toward personalized medicine. Share this video with anyone who might find it helpful, parents, clinicians, or young adults. Knowledge is a step toward better mental health care. Medication isn't the only way forward, but it could be a step in the right direction.